Welcome everyone. The OSCE can be a little bit stressful as students prepare for it, so we wanted to do this quick video just to walk you through the steps so when you take the actual OSCE you're not distracted by the logistics of taking the OSCE. So hopefully this very short video will be helpful to you when you take the OSCE. For this scenario, I'm going to be the student logging into the station after having received the orientation. So come watch me. I will log in with the assigned login that I've been given. And then overhead you'll hear the exam is starting now, and I start the encounter. What I see here is the instructions that I need to read carefully. And then what you see here below is some patient information. So you can see that the chief complaint of this patient is headaches. I see vital signs. I also see that the patient was seen in the emergency room, looks like, and had a CAT scan 4 days ago. I can view that image, and it gives me a sense that the CT scan is normal. Then I close it back up. I also see that the patient had a visit 1 year ago. And please review the notes carefully because that may have some important information. And I can scroll down and look that the assessment and plan was basically normal with a little bit of allergic rhinitis. I close it. I also can look at the problem list, any medications that the patient's taking and any allergies. So what I would strongly encourage you to do is really take some time to look at the past medical history, look at the chart before going into the room so you're well prepared. Then you can hit the continue button and it tells me that I'm now ready to go into the room. Hello.
Hello.
My name is Beat Steiner.
Hi, I'm Kelly Bossicker.
Very nice to meet you. I'm one of the medical students, and I'm going to talk to you a little bit about what brings you in today.
Okay. So, I've been having headaches for a few months.
Can you tell me a little bit more?
I've had headaches. I think they started a few months ago. They're kind of all over my head. My whole
And then
head
keep
hurts.
looking at exactly the same place. So I see both eyes looking completely fine.
You have 15 minutes remaining in the station.
So you just heard the announcement overhead. So I've got 15 minutes left in the station, and that's a reminder to me that I should probably wrap up fairly soon so that I have enough time to do the written part of the work. You'll get several more announcements. If you get the last announcement, that goes something like, there's 5 minutes left in the station, all students will have to leave. So I'm done with the exam now, and what I do is I now go back to the computer and finish the encounter. So press stop encounter when you've completed the encounter with the patient. And now you're at what's called the post-encounter write-up part of the station. What you again see is the same information that you saw before, the CAT scan, the clinic visit 1 year ago, and the medication list, just to remind you if you need reminding. And then below you have several boxes that you need to fill out. So first, and this is the same questions that you have on the PowerPoint that's on the website. Written task, history, so document the subjective portion of the SOAP note. So I will write now what the person presented with. Then the next one is differential. I'll create a differential, write that out, then write out the evaluation that I want to do right now, and then further talk about management, what I plan to do down the road. And lastly, think of some prevention items relevant to this patient. Now, the prevention items have to be U.S. Preventive Services Grade A recommendations and don't necessarily need to relate directly to the patient's complaint, but they do need to be relevant to the patient's gender and age. Then logged out and completed my encounter on the computer there. Meanwhile, the simulated patient is also doing work on the computer. She's grading what I did during the encounter. So let's go have a look.
So as the standardized patient, I'm coming over to the computer and filling out several questions on the checklist about the interview. For example, for the physical exam, did the student assess neurologic function, like the strength in face muscles or arms or legs or balance? And I just say yes or no whether or not the student did that.
The other thing to remember about the logistics of the OSCE is later that evening, I will grade other parts related to what you wrote on the post-encounter written portion of the test. So on the computer, and I'll show you briefly how I do that, I will grade your portion that you wrote. So when I grade this, after you've completed the OSCE, I come to kind of a similar screen on Beeline, where what I see is the checklist that I use to grade. And so I look through the note, what the student wrote. History of headaches since teenager, but have gotten worse in past 6 months. In past, headaches were monthly, not associated with menstrual cycle, pain 7 out of 10. So doing a good description of the headaches. I look to see if this patient mentions anything, the student mentions anything about use of ibuprofen. And I don't see that there it is, and relieved by ibuprofen. Doesn't really say that she's using it frequently, but I'll give credit for the moment. I hope this short video was helpful just to get your nerves calmed down a little bit and allow you to do your best clinical performance on the OSCE without being distracted by the logistics.